So I was reading a patient story the other day where this person's dad had a really bad knee. He was going in to get a knee replacement, and then they looked at the X-ray and they actually found that the other knee looked just as bad, but that other knee didn't have any pain. So this begs the question: do you really need a knee replacement if you don't have pain, but an X-ray shows there's arthritis? And the answer is no. There are actually three criteria that are required to warrant a knee replacement. One being, yes, you do have to have an X-ray that shows arthritis, but more importantly, number two, pain must be present. And then number three, it must cause a decrease in your ability to do normal activities that you would do otherwise. So without those three things present, there is no need for a knee replacement, and it's always best to start with physiotherapy before looking into a knee replacement.